Welcome back, guys. I am here with Dr. Jason Smith of Atlantic Health here at Atlantic Sports Health, and we're talking about proper back hygiene and low back injury and disc bulging, herniation. Talked about a lot of different things on our segments, but we want to talk today about proper bedding. We want to talk about hydration with the lower back, even foods. I know you've shared a lot off camera before, and I felt it was so valuable. Talk to our audience about these things in terms of what we can do to keep a healthy low back.
Well, one of the most common questions that's asked to me is, what is the best mattress for me to sleep on? And my answer is simply whatever feels good to you at the time. Quite simply put, your preference for a mattress will change just like your taste buds. Over time, it's just going to adjust to whatever your current need is. So there's no right or wrong mattress. You obviously don't want a mattress that's going to not contour to your body from time to time. There's some memory foam mattresses out there that after a while of sleeping in them, you don't get that adjustment that you may or may not need. So that is the one important thing. But outside of that, there's really no right or wrong. Whether it's a very hard mattress or a very soft mattress, just make sure that it's comfortable for you and it gets the job done. As far as foods, some of the biggest antagonizers of inflammation in the body is first sweets. So if you have a sweet tooth, I'm sorry to be the bearer of bad news, but sugars can really do that. Now, natural sugars from fruits, that's one thing, but when you talk about processed sugars, that really promotes inflammation in the body. Another food that actually promotes inflammation is milk.
Wow.
Casein in milk actually promotes it. So milk, cheese, anything dairy, tends to promote inflammation.
Promotes inflammation. Yeah. That's really important, right?
And the third one that I do talk with patients about is bread. Bread, gluten products, that can really promote inflammation as well. Now, on the flip side of that, you have certain foods that you can have that really help with anti-inflammatory properties, such as natural fruits like blueberries, strawberries. Those are very big anti-inflammatory foods. Turmeric, curcumin, that's a big anti-inflammatory, and you can actually cook with that. You can season your food with that. Ginger is another very big one that I tend to tell my patients about. You put that in your food. You could take it in capsule form, what have you. And sometimes what patients really like is just a glass of red wine at night can sometimes help with inflammation. Not too much.
They'll be happy to hear that.
And not a large glass, but
I mean, you're really on the cutting edge here, where you're a medical doctor, but you're talking about nutrition, which is so important. And not many medical doctors are speaking about nutrition with their patients. And I think it's so important that people can take action and make some choices, and better choices, cut down the processed sugar, cut down the milk and dairy, and get a response, without a doubt, that can reduce inflammation.
Yeah.
How about hydration?
Hydration is very important, not just for the spine, but for the entire body. And that goes back into the disc as well. When we lose height, that's because we're losing hydration from our discs.
Yeah.
So, staying hydrated really helps to, once again, help prevent that degenerative disc disease from occurring as quickly as it might occur.
Wow.
So a couple of glasses of water a day will take you a really long way.
Wow, that's awesome, Dr. Smith. Thank you so much. Really great information. Take advantage of this. Again, when you make good food choices, you're not only going to, probably lose some pounds, lose some excess body fat, you're going to definitely feel better and be in less pain.